Hello, everybody. I have 9:45 when we're officially supposed to get started. Is that correct? Yes, sorry. It's 9:45 my time. All right. Well, did anybody have any issues getting signed on from non-WSU accounts? Everything worked fine? All right. Well, I'm sure that we will have more people joining as we go forward, but I'll go ahead and get started on the first part of it so we can hand it over to our presenters and make sure we have enough time for comments, feedback, and questions. So this is concurrent session number 2D. The health concurrent session. We have 3 presentations today. So I'll go ahead, and the plan is I'll introduce each of the new presentations when the others are concluded. I'll also keep track of time, and I will pop in the chat when you're at 10 minutes, when you're at 15 minutes, where I suggest that you stop your presentation, and then we'll have 5 minutes for questions. So I'll pop in 10 minutes, 15 minutes in the chat, and 20 minutes so we can keep track of that. Let me go ahead and acknowledge our sponsors as we do. Make sure I click on the right screen. All right, so thank you to our sponsors. Our platinum sponsors are University of Idaho Extension and Washington State University Extension. And our bronze sponsors are here. So I'll leave that up for a little bit to acknowledge everyone who makes this conference possible. All right. With that, I'm going to go ahead and stop share on my screen so the presenters can share on theirs. And our first presentation, the lead presenter is Chris Meyer at Utah State University, and the title of the presentation is Rural Comprehensive Community Needs Assessment. So I'll go ahead and turn it over to Chris.
Thank you, and I apologize, work from home, my dog decided to start barking right at this exact moment. So we'll see how that works out. I might have to run and grab her. So if I leave the screen, I'm still here. I'm just grabbing her to get her to stop. So thanks so much. So I'm Chris Meyer. I'm an assistant professor of social work and the community resource and economic development specialist with Utah State University Extension. Dr. Narayan is also sitting in today, and he'll be happy to answer questions at the end as well. He is the evaluation specialist for Utah State University Extension. So today I'm going to be talking about our experience testing out a rural community needs assessment process that's informed by best practices as part of a research project that we conducted in the last couple of years. So as everyone knows in Extension, we sure love our needs assessments. So I'm quite new to Extension. I'm just finishing up my 2nd year, going into my 3rd. And I remember when I started this position, I was told you're going to do a statewide needs assessment, or you're going to do some kind of needs assessment. And I was like, okay, because that's what we do when we start. And that's kind of the direction I was given as a new specialist. And, of course, as a social worker, I was already familiar with needs assessments. I hadn't really done that many. I tended to do more program evaluation. But, this 3-stage needs assessment is pretty familiar and a standard process. And needs assessments are really important. They tell us a lot about our community. They help communities really assess needs from multiple perspectives. So one thing I'll be talking a lot about today is community representation as part of like a community-based participatory approach. And that's really important because when we have too much of a similar population at the table, we tend to miss important views when we're determining community needs. As a social worker, we tend to not like this idea of needs assessment. We tend to prefer the framing of asset mapping or assets instead of gaps and resources. However, needs assessments are really stellar at telling us our community strengths and kind of existing gaps and where we could go in our community. Helps us prioritize needs and make a collaborative action plan. So this is the one piece I really love about needs assessments is, yes, they point out those gaps and those needs, but they really help us as a community prioritize where to go and how to do that collaboratively together with organizations. And like I already mentioned, to me, a really important piece is promoting that representation of communities from various backgrounds. So when I started as a specialist and I was like, here, go do something, right? Do something that needs assessment or something. I looked at the rural needs assessment literature and I found there were significant gaps. So when we look at community-based participatory literature, and specifically needs assessment literature, we don't really find a lot of unique rural best practices or ideas, right? A lot of the literature out there is really pointing towards more urban-based studies and things like that. So I'm not going to say I think that the process is any different or that the best practices are different, but I think there's a different emphasis on what we should be doing in rural communities. So I decided that I was going to undertake a research project to kind of understand what experts, which I call experts, thought were best practices for rural community needs assessments. So today, what I'm going to talk about is that how we kind of tested the usefulness and appropriateness of the 3-phase needs assessment, injecting these best practices from experts in our research findings. And I'm just going to talk about how this all played out with this one rural community and this effort's kind of still ongoing. So just to kind of orient you to the actual community and where this work was done. So, and I'll talk a little bit more about the research project and the research findings since they inform this work I'm going to talk about. But the actual 3-phase needs assessment I'm going to talk about today occurred with one coalition in one rural county in Utah. This coalition was really exceptional. So it was a very small county as far as population wise. There were multiple tribal communities within this county. And, but despite being very rurally located, very isolated, it's, you know, quite a long trip to any kind of urban metropolitan. There were 70 local organizations represented within this coalition. So it was a really, really special community, as all our rural communities are, right? They have these really special qualities to them. So that's kind of just a basic understanding of where this work takes place, because of course I want to protect the identity of this county. So, you know, we have a couple of approaches that really determined how we did our work with this community. So first, we were using a community-based participatory approach that was really heavily grounded in community-centered or community-led assessment. So the idea is that they were really, I call them the expert and the guiders. And then we used our expert scientific knowledge and ability to do surveys and things like that to help promote and move the process along. So what the kind of project phases look like and how it kind of carried out over this period was, so we did a pre-assessment phase for 3 months. And basically I was new. I don't live in the county in which I was doing this work. I was introduced by the local county faculty. She kind of gave me some credibility and said, hey, this is Chris, she wants to work with us. And so I took a lot of time, and like I'll talk about in the results, getting to know the community and making professional relationships and things like that. But really we spent the first 3 months organizing brainstorming sessions with the coalition, we did about 30 stakeholder interviews to understand what people thought was going on in the community. And there was a lot of representation of the 2 different tribal communities, different orgs, different residents. It was a really interesting experience, and took some time to do some pre-survey work where we took those stakeholder interviews and the brainstorming sessions, synthesized those together to work with the coalition to kind of identify key areas they wanted to see in their community health survey. And then the assessment phase, this took quite a long time because COVID happened. So this is where we're working with the coalition to construct the survey. So it was always kind of slated to happen in the summer of 2020. But it took, and we got there, but it took quite a bit of work with COVID going on to really get the survey out there. But we worked with a key stakeholder group within the coalition to actually construct the survey, make sure it was on the track they wanted, and then really relied on our coalition to distribute the survey completely to the community. And then currently we're in the post-assessment phase. This is ongoing. So I'm sure many of you have experiences where this is really the long haul phase. I keep going back to this community and this county and saying, like, I'm here for you. This is, you know, trying to propel action here, but really we're working on not only continuing to distribute the results like 7 months later or 6 months later, but also still talking about organizing and strategic planning and really making use of that effort and ongoing plans to collect the survey at 2-year intervals, where myself as a researcher has to be less involved and they can be more operate more freely without me unless they need me. So going back to this research project that I did before we started the work with the community. So we did these interviews with, it was about 18, what I call experts. Some were in extension, some were social workers, some were in public health. They talked about things that they did that made their community needs assessments successful, or what they'd call best practices in their rural community needs assessment work, right? So some of these were CHNAs like that we expect to see through public health, but also we had a number of folks from extension who were represented who talked about, some were talking about more of the asset approach and some more the needs. So we had 3 best practices that were kind of salient and emerged through the interviews that guided our work with this one county where we tested these best practices. And I don't think to anyone listening here, these are going to be new or groundbreaking. I think what it does is it just contributes to the literature and saying, yes, these things really matter. They matter a bit differently to rural communities, and they manifest themselves differently in each different like experience with a community, right? It's going to be different for every community. So best practice 1 was using the participatory approach throughout. So all of our experts talked about who should be at the table, making sure that this participatory piece isn't just that pre-formative piece and the pre-assessment phase. They need to be involved to the ability that they can and that they want to be involved throughout the whole process. So making sure you don't take over the process as the county faculty or the extension specialist, making sure that you are really truly collaborating and including residents, stakeholders, community leaders throughout the process. Best practice 2 was investing in a relationship building. So I really liked this one. This one, again, isn't a surprise, but I think what was so interesting was the way it kind of emerged. So people talked about being not only like transparent about your process, but like being there. So physically going to the community, driving around, going to community events, making yourself as visible and tied to the community as possible. And then considering the importance of future relationships. So not just focusing on this project, but long-term, what's your investment in this community going to look like? And then finally, best practice 3 is the investigator-specific approaches. So this is what the expert did that was kind of their own thing. It wasn't necessarily something that everyone did that worked for them. So one thing is like knowing your role and what piece you're going to play, using open communication to be really like clear and transparent, and making sure you're using an individualized approach. So what was our data and analysis for the testing of these best practices in this community? Well, we just used field notes to collect kind of our experiences throughout, and then just did a thematic analysis. So the results I'm going to talk about just briefly are within these 3 areas that I mentioned were best practices. So for relationship building, what we ended up experiencing was that really important piece of being present in the community, just like the experts talked about. So in our rural community we worked with, being present and physically going down. So it was very far. I am located the farthest from that community I possibly could be in my state. And so it would take me a full day just to get there and a full day just to get back. So I would go one week every month or every other month. So it was a serious investment in this community, but being present was really important. The coalition leader was definitely a gatekeeper and tended to not trust outsiders. So the more I showed my commitment to this work and this community, the more trust and capital I was able to build with this coalition. Regular check-ins and deadlines were something that came up with relationship building that was important. So while the community and the coalitions wanted this very much, they really wanted to go under this needs assessment. This was a county that very much so wanted more data. They're kind of data hungry. We still, as the expert or the extension person, really needed to push the process along, right? Because they are doing their work and they're doing their family stuff. And while it's really important to them and their organizations actually needed this for some org reasons, it required me to be like, okay, we're meeting on Tuesday and we're pushing it along. The other thing that I think really came up, which was important throughout, was this idea of shared power. So I always made sure to demonstrate that and really articulate that this was a shared power. There's shared power in this project, And that I was very open with them. This is your data. I'm not publishing with this data. I'm not sharing information. This is yours. These are your products to decide what you want to do with. And by making sure that when they actually asked and wanted to change a measure, unless there was some reason to not have that happen, it happened. Like they directed the process, and that really increased our trust and increased our relationship, and has done a lot for our ability to work in that community. And then I think just constantly going back to framing the community as expert was the thing that emerged here, is just constantly telling them, you know your community best, we will listen to you, we will do what you say. So for the investigator approach, you know, we only exerted expertise when needed around methods and data collection procedures. Otherwise, we tried to ground it in the community and what the community wanted and the process they wanted to follow. And I think that worked really well for us. So the coalition would say, well, you know that better. And so then that would be my cue, like, okay, I can exert some of my expertise. But when they were not saying that, I always tried to say, great, you're the experts, let's continue to follow what you're wanting. Again, that scheduling of meetings was really important. You know, I think the other thing was balancing of roles. So making sure we were doing a lot of things here. So there was this coalition, and I was with extension, and I'm with social work, and their families and residents and their tribal communities. And so really encouraging them to balance their roles and my role as well. And making sure that we were all comfortable with the process and how things were going. So I know I'm getting short on time, but I really want to make sure to get to talk about this last one, because it was really an interesting experience. So again, this best practice of a participatory framework throughout came from our experts, and not surprising. Of course, engaging stakeholders from the start. We did that. We were very community focused. We had a couple of interesting things happen here that I think are not novel, but interesting to point out. So the first thing about diverse representation, the coalition itself was very diversely represented. When we interviewed stakeholders, very diversely represented. I think we actually had overrepresentation from our tribal communities. But when it came to the actual time to create the survey and have coalition members have their voices heard and make changes to the survey, even though there are opportunities to the larger coalition, the champion, who really was the coalition leader, became a gatekeeper. So she became the gatekeeper of the data, she became the gatekeeper of the process, she became the gatekeeper of the measures. And so that became a problem, in that there wasn't representation always in the ways we wanted. The other issue was related to ethics. So this community specifically is, like I said, there's 2 tribal communities, and there was this experience where they wanted to actively recruit tribal community members on the tribal community property land. And I said, I had to push back because of my ethics as a social worker and a researcher and a person. And it was really interesting to try to navigate this process with them and still be able to have trust and a good relationship by pushing, and also push back and say, I'm not comfortable with that. So I think the biggest lesson learned from that and that issue of ethics and using this participatory framework is sticking to your ethics, but also still being able to have hard conversations with your collaborators and still allowing them to be the experts, but having those clear ethic boundaries. So I don't really want to share what happened, because that would be identifying of the community. But I will say that's an interesting thing that I did not anticipate occurring, that no one really talked about in their expert interviews, was that issue of ethics and having those hard conversations and how to come over that. So we ended up doing fine and came to a resolution, and the survey moved forward and it was fine. But I think it's a real important thing to consider as community workers. You know, how do we make sure we keep our relationships in a positive way, still let the community be experts, but then also be true to our own ethical considerations. So just to wrap up, our implications for practice are that the 3-phase approach worked great. The best practices really led our project well. They resulted in really positive and long-lasting relationships. So I think it really strengthened not only my ability to work in the community, but extension overall. So now we have this gatekeeper who's now said, oh, great, come with me with all your stuff. So we have a way into the community when it was a hard to reach community. And then finally, I think that it just reminded us of this ethical issue, but not only that, how do we as investigators continue to learn from our communities and be reflexive to what they want and to not always use a standard approach. That's really important and just meet the community where they're at. So with that, I think we have about 5 minutes for questions. I tried to talk fast as I could. So I'm going to stop sharing my screen and please let me know if you have any questions.
Actually, if I'm keeping time correct, we have about 2 minutes left for question and comments, but it happens. So we'll open it up and questions, comments. I know there's a comment in the chat. I appreciate the nuances you are sharing, but trust seems like a major foundation of the work. So are there other questions, comments for Chris?
I'll just share briefly that I'm really appreciative that you actually got into the literature and are adding to it. That's like the association, this work, this field. It is really challenging to find things that are rural focused. Yeah, in Minnesota, we've got an assessment that we're doing for doing work around anti-racism that our folks in evaluation have been working with around community capitals. And it's just alerted me to how there's not much out there. And so I'll be telling our crew about your work, Chris. Thank you.
Yeah, that's so true. And it's taken us a long time to write the manuscript because when you're doing community work, you don't necessarily have time, but we are finally writing this manuscript. So it should be out there in the next year. So yeah, but
we're going for rigor, not rigor mortis.
I know, right?
Oh, any other questions, comments?
Real quickly, name one facet that in particular stood out about rural versus the urban or more or other settings in the literature.
Yeah, so I think the big thing is about so I don't think it's something that explicitly came out in our expert interview piece, but just that existing network utilization and how to best make that organizational network operate in the best way possible, right? And so really we can't add more resources often. We have to make it work a bit better. And so using your trust and relationship building as an expert to be able to say, let me help you improve the ability of the orgs to work together as a collective impact to address some community issues. Hopefully that was helpful.
Right. Chris, do you want to maybe put your email in the chat so if people have additional questions or comments, they can either put it in chat or just email you directly. It might be a great way to get a hold of you because I'm looking forward to the manuscript. So,
thank you.
I'd like to see that. All right, with that, we will transition to the next presentation, and that is the lead presenter is Alicia Espinosa, and the title of the presentation is Using the Housing First Model with Nonviolent Drug Offenders, a Community Action Approach. And with that, I will turn it over to Alicia.
So hello, I'm Carl Eric. I'm her co-presenter. We're having technical problems. We're working on trying to get it resolved. I could probably try to do her portion of the presentation, or maybe you could put us on the third slot.
Yeah, maybe we can go ahead and do that. Is she having problems signing in, or what's
She's having problems. This is not the first time it's happened on her end. It sounds like it's on her end with some kind of sign-in credentialing or something.
Will you let her know? She might already know this, but because I'm a WSU faculty member, in order to access Zoom for WSU, you have to be signed into your Zoom account on the computer and then click the link.
Okay, I will let her know. Thank you.
All right, so we'll just go ahead.
And also send her to Melinda if she needs extra help. I can try to help her on the backside. So
great. So we'll go ahead and go to the. I hope that's okay. We'll go to the third presentation while they're resolving their technical issues. So the lead presenter is it Maisie? Is that correct? Is that pronounced correct? Okay. Maisie Smith, Mississippi State University, and the title of the presentation is Community-Based Research to Address Health Disparities. So I'll turn it over to you, Maisie.
Perfect. Okay, well, let me get this shared. Okay. do y'all see the slides? Like the
Yes.
presenter slides? Okay. Well, my name is Macy Smith, and today I want to talk a little bit more about our Center for Disease Control and Prevention community-based research program that we have used to engage our coalitions and communities to address health disparities.
Macy, really quickly, your presentation is not in slideshow or presentation mode. Do you want to do that, or?
Yes, I can see it, but let me reshare.
Yeah, no, it closed out. If you,
Okay, let me do this. Is that better?
there we go. There it is.
Okay. Okay. So I work with Dr. David Bies, who is also at Mississippi State University, and he is the state health specialist and associate professor here. And we work in quite a few of the Delta counties that are in Mississippi. So to give some background about our work and what we do, in 2018, we were competitively awarded the Center for Disease Control and Prevention funding for the High Obesity Program. It's one of a cluster of funding opportunities. They also have REACH, which is the Racial Equity Grant. And ours is specifically focused on preventing and reducing obesity. So the funding really looks into coalition work, and it's very community connected. So the CDC has slowly steered in that direction of funding these types of projects that go to the community, and they're not as prescriptive as we might have seen before. And instead of saying, this is what you do and this is how you do it, they say, hey, we've got some evidence-based strategies, and we noticed that, you know, you've got 12 counties with an adult obesity rate of 40% or greater. How can we contextualize this research to our rural communities and use the land grant extension model to address these? And so we really try to engage our local champions in this and start from this policy system and environment framework to do that. So as you can see in the state map, most of the counties are actually pretty clustered together. Those are primarily Delta counties, and we've got a few outliers. So the ones in maroon and the ones that we're currently in are Sharkey, Washington, Issaquah, Sunflowers, Humphreys, Holmes, LaFleur, and Quitman. We've recently expanded into Noxubee County, which is another outlier. And we have a few Claiborne, Jefferson, and Jeff Davis that we have not begun expanding into. So what do we do and how does it work? The funding for ours, the way that we applied is we primarily focus on physical activity and active living. And really with physical activity, we try to think less about going to the gym and think more about built environment and active living, that habitual and integrated cultural aspect of what makes a community healthy. Quite often when we think of physical activity, that's more on the individual level. And we also know from research and just the contextualization of what barriers individuals might face related to health, that those types of amenities aren't always accessible or available to the community members that we serve. And so we try to create these equitable solutions alongside the community members and provide them the technical assistance, resources, funding, and support that enables and empowers them to find the solution that works best for their communities. This is similar when we look at other focus areas of our grant. So we have nutrition standards and food service guidelines. With nutrition standards, we've primarily focused on food pantries. That's been a little bit of an organic shift of our team. So in that aspect and in that regards, we've focused on client choice. We hope as some of our pantries are returning to doing fewer drive-throughs and more of this in-person receipt of food pantry distributions, that there's more social connectedness involved with those interactions, and we strive for transformation over transaction, meaning that in our food pantries, it's not just the exchange that counts, that somebody's receiving a service and we're checking it off our list. We're looking to build those relationships, because those relationships are what really get us deep in the roots of health disparities and how to, you know, again, engage people in doing what's best for them and their families and their communities. Finally, we'll look at food systems. And so what we've been doing really is working with our food pantries. That's been, again, one of our focus areas. And then we have had some trial and error with what works, especially being in very rural areas of Mississippi. You know, we looked into corner store initiatives, and you have to have corner stores to have corner store initiatives. We've looked into working with grocery stores and hospitals, and we've got a few communities that and counties that do not have a full service grocery store, and they don't have a health clinic there. So we've really worked around trying to find the best way to meet individuals' needs without kind of saying, okay, well, that was difficult and we're not going down that road. And, you know, we figured out the ins and out of that, and that's a closed door. Instead, we really make everything community led. And so a lot of what we do is based on our coalition meetings and leveraging pre-existing relationships in our counties. There's 82 Mississippi counties, and Extension is in each of those. So we really try to go using that approach. So in general, policy, system, and environment is really designed to make these structural, cultural, and roots changes of what helps you best promote like the quality of life where you work, live, and play. I mean, it's really taking the nuts and bolts of different pieces of that, whether it's the policy piece, MOUs, shared use agreements, that piece, and then carrying it all the way out and saying, overall, like, what's our goal? And let's work backwards, and let's create these milestones and these action steps so that when we have that vision of where we want to go, we have this overall, this change that occurs, and it's sustainable. It's not short term. It thinks about the vision of our communities. And of course, as we think about the social determinants of health, the two words that come to mind are accessibility and availability. And the way that we address those and we integrate this cultural sensitivity and look at these issues and these opportunities and what we can achieve is by contextualizing things that maybe the CDC have recommended, or other organizations, or even on a state level. If you go to Jackson, Mississippi, or if you go to Hattiesburg, or if you go down to the coast, it's a lot different than the Mississippi Delta, which has been profoundly impacted by environmental disasters, prevalent health disparities, quite a few which are related to obesity. And so we start first with listening, and then we move to the question part, which is, how can I help you achieve that? How can I help your community do that? And then, of course, it's based around these shared goals of the community. So we start with this we call our coalitions to action, or we leverage pre-existing relationships. We create an action plan that's comprehensive and involves multi-sectoral collaborators. And we say, hey, we're all working on the same page, and how can we leverage what you have, what I have, what we have collectively to reach where we want to go. Then we design our community action programs. We are very fortunate from our CDC funding, which is from 2018 to 2023, that what we have really made efforts to include is approximately 1/3 of our funding, which is $1.1 million per year, going directly back into communities in the form of mini grants, technical assistance, and training. And so that translates into these action projects that they submit to us. We get approved by the CDC, and they're able to at least see part of their work translate into the actual community. And it also gives them an opportunity where if they are wanting to apply for additional funding or find other collaborators, that they can easily do that because they've received funding before. And then we go into the implementation stage where they put that, what they've written to work. And then we evaluate and sustain that work. So I can't stress enough how that part is quite often skipped over. And so you'll have a pop-up project for 3 to 5 years and then it'll disappear. We try to either add to pre-existing projects or again, go for that PSE change where they've got, you know, they've got skin in the game. They've got these collaborators from across their counties and they're willing to put in the work to make it sustainable. And then finally, we do continue with that with technical assistance and training. So I wanted to share a little bit about community-based participatory research, which has been a really big shift with the CDC and extension. And sometimes we have this separation of research and practice. So the praxis is a little bit of a juggling game of, okay, well, there's research on this, and then we're trying to do it here, and then the community is not bought in. So you've got this kind of like separation of those. This group is in Belzona, Mississippi. So this is the Keep Belzona Beautiful Garden. And I want to use this as an example because this has just been a beautiful example of how a community has come together. They have illustrated how in the past they have achieved shared goals and focused on shared projected outcomes, and then just come together to do something. So what started out as a few flower beds that we funded, 2 to 3 years ago, it's now, I think, 30 or 40 garden beds, and they have multi-sectoral collaborators from youth, school children, parents. They used an area of the fire station that wasn't being used. They used a shared use agreement so they could use the grounds there. They've engaged business owners. They're borrowing city farm equipment. And so it's been just an example of how this really comes together. And as you can see, it's not just our funding that makes this happen. That's just a piece of it. It's us coming together and deciding, okay, well, this is what has been done. This is what could be done. This is where they want to go. And this is how we can get there. As you'll see in this picture, they had done the garden beds. And then of course they had a bunch of, weed issues. So they cleared it off, added more garden beds. And then they were adding in like the weed protector. And then originally they added some hoops as well. So from this experience and just us using this kind of these evidence-based practices and then applying it to a very rural area, what some of the steps that we lay out for our communities are identifying the need, identifying potential collaborators, coming to a shared purpose and vision statement. You might wonder what a youth group or a 4-H group has anything to do with a food pantry or community garden. But if you have a 60 or 70-year-old food pantry operator who can't operate a computer, and you have a youth member who can create flyers, who can do the master spreadsheet, you've got a collaboration that is necessary, that's sustainable, and that's going to be beneficial for both the youth and the pantry operator. Identifying a priority population to be impacted, and this goes into the MOU. In our practice, we have not, we really try to promote these that are together. So we don't want a freestanding food pantry. We don't want a freestanding community garden. We want there to be this connection between, okay, well, we have this community garden, and then down the street we have this food pantry, which again, in the case of Keep Bowls on a Beautiful, that's what they've done. So they created this memorandum of understanding saying, we've identified the elderly or the older person's population as the priority here. How can we best serve them? And then this goes into ways to track outputs and outcomes. So when we're looking at their mini grants, we also buy scales so that they can weigh the food. And we buy other items so that evaluation is much simpler. And then we help them with technical assistance in creating the best spreadsheet for that. So a lot of our gardens use the same thing. We try to track how many pounds they've produced, how many varieties of fruits and vegetables, what their collaborators are, and then we track leverage funds. So if they do have, church groups or whoever to come and volunteer, we want to know how many people, and then use the national rate, which right now is around $26 an hour for that. And we calculate, and for them, that's just, for our program and for our Mississippi communities, that's so impactful, because a lot of the times people will say, well, we don't have anything, and well, we haven't received any money before. And we go into leverage funds and they realize, wow, last weekend we had 20 people come and volunteer for this many hours. That's worth $12,000. And so
Maisie, we only have about 3 minutes for question and comments, so if you can wrap it up.
Yes. So creating that has been really important. These are just a few more pictures of the garden and our collaborators. But if anybody has any questions about that model or what we're doing.
Yep. Any questions or comments? There was a comment in the chat. Michael Wilcox, farm raised catfish capital of the world, cool photo. So appreciate that call out. Yes. If you also want to put your information in the chat, I think that'll be helpful for people who want to contact you. Questions, comments on this presentation? Got to have some questions or comments, or I'm going to feel bad for cutting her off early. So we can have questions or comments. So,
Macy, when you're looking into health disparity literature, where are you finding some of your best information?
Right now, there's been a lot, there's been a lot of literature about health disparities. I'm trying to think, JAMA and HPP, so health promotion and practice. We're currently doing a SOFI workshop, trying to put out some of ours because we're a non-research grant, but they still want us to publish. So, we're going through those steps and putting out our own, but I think health promotion and practice has put out some, and then CDC did post in their journal, and I forgot the name, but they posted Auburn's is in there. They did some focus groups, and then they posted some of their original work, like from year one. So.
Okay, that's super helpful. Thank you.
Any other questions or comments? Well, thank you for your presentation. It was fascinating. So thank you for that. And with that, are our next presenters, were you able to deal with your technical issues?
We should be good.
Okay.
Here.
All right. So we'll go ahead and go on to our last presentation. The lead presenter again, Alicia Espinosa, and the title, Using the Housing First Model with Nonviolent Drug Offenders, a Community Action Approach. And go ahead and take it away.
Okay, can everybody hear me?
Yes.
Okay, I just want to say thank you, since we had those technical difficulties, for the people that went before us, and I apologize at the same time. Anyways, my name is Alicia Espinosa, and I'm going to be responsible for presenting the first half of this presentation, which is going to focus on research that I conducted between 2018 and 2020. And then my partner, Carl Eric, will be presenting the second half, and he is going to be discussing how to put this into a community action approach, implementing the Housing First model for nonviolent drug offenders. Oop. I'm sorry, I didn't have it in a slideshow. There we go. But first, I would like to thank Dr. Michael Wilcox and Dr. Nicole Adams for making this opportunity possible. And
Really quickly, we're not, if you're sharing your screen, we're not seeing it.
oh my gosh. Okay. Sorry about that.
Yeah, it should be at the bottom.
Yep. Thank you. Okay.
There
Now,
you go.
can you guys see? Okay, so you guys can hear me, but then, okay, I'm sorry about that. This is like, it's gonna be so nice when we can do this in person again. But anyways, but I would like to thank Dr. Michael Wilcox and Dr. Nicole Adams for supporting Carl and I on this project. Oh, why is this not? Oh my gosh. Okay. My research question was, how often are nonviolent drug offenders denied housing? And this was originally part of a larger project that actually asked how often are nonviolent drug offenders denied employment and housing. But for the sake of this project, we are only going to focus on the results of the housing part of the study. Currently, incarceration rates in the United States are on the decline, but the United States still incarcerates more people than any other country in the world. Laws dramatically changed in the 1980s as the war on drugs gained momentum, leading to increasing incarceration rates specifically for drug offenses. During the 1990s, the Clinton administration implemented some of the harshest policies, which included denying public housing to nonviolent drug offenders. With 700,000 people being released from prison each year, parameters need to be put in place to protect this population from discrimination in the housing sector. Currently, many communities are putting together what they call recovery-oriented systems of care, which supports a public health approach using harm reduction methods. So these punitive type of policies contradict what OROSC is trying to achieve. Drug offenders have two stigmas to get past, that of a drug addict and that of a felon. And this is detrimental for opportunities, but it also impacts public health policy negatively, as stigmatizing attitudes can dictate what policies are passed to help ease re-entry. Nonviolent drug offenders are not finished with their sentence upon release, as they are denied housing often, and this follows them for a lifetime. The federal government gives public housing authorities and local communities free rein on how to interpret the policies that they have put in place. And in many cases, unfortunately, this results in local public housing authorities to place stricter bans on people. For example, there's the One Strike and You're Out Act, which is just a mandatory clause that the Public Housing Authority has added addressing drug activity. This mandatory clause must be written into every single lease agreement for public housing. Part of it addresses drug activity, specifically stating that any drug activity committed by the tenant, by a person living in the house, or any guest that has entered the property is grounds for immediate dismissal, and there are no second chances. This policy was contested in 2002 in the U.S. Department of Housing and Urban Development versus Rucker, but in a unanimous decision, the court upheld that statute, which basically means that a whole entire household can be evicted from the premises based on one person's actions. And the person holding the lease does not necessarily have to know about those actions. And this gets me to my research. My research, I used a sampling method. I used the qualitative part of this research involved using a non-probability technique in which each participant was recruited because of their shared attributes. So for my research, you had to have nonviolent drug offenses on your record. You could not have any violent offenses. However, I did not exclude people who had other nonviolent offenses. For example, like theft or probation violations, they were still eligible for my research. I also hung up flyers in places where I felt that people who had a drug offense were likely to congregate. So I hung flyers at mutual aid support groups, like 12-step meetings, Celebrate Recovery. I hung them at recovery housing, transitional living facilities. The demographics of my participants, I originally had interviewed 31 people, 16 women and 15 men, but 2 of the women had charges that disqualified them from the study. There wasn't very much variation as far as the race and ethnicity. Most of my participants were white, although I did interview people from 7 different counties in Indiana. The youngest person was 27, the oldest was 52. There was a lot of variation in their education level, as the person with the least amount of education that I interviewed had an 8th grade education, all the way up to a doctorate in law. And I do want to point out that many of the people that I interviewed had college educations. I had a couple that had master's degrees, bachelor's degrees, a couple with associate's degrees. And I think that's important to point out. Some of the results, 72% of my participants said yes when I asked them if it was difficult to reintegrate into society. Only 19 out of the 29 people from my study expressed difficulty in getting housing, but this isn't because the other 10 found it to be easy. It's because the other 10, it was not applicable to their situation, mainly because either they were relegated to such low-paying jobs that they couldn't support themselves, or they had been in and out of institutions so much that they never really had a lengthened period of time where they were provided an opportunity to live anywhere. So when I asked them how many times they were denied because of their criminal background, 247 times. There was an outlier. One woman said that she had submitted 100 applications and had been denied 100 times. But even eliminating that outlier, what I found was that men and women had similar experiences. They were denied very close to the same amount of times. No matter how well educated a person is, a felony is still a barrier to find housing. And people who identified as being in recovery had better outcomes finding housing. And this is mainly because they had social support. So people that would vouch for them. And when I interviewed the attorney, which to protect his confidentiality, I named him Tom. When I asked him if there was anything else I haven't asked you that you think I should know about having a nonviolent drug offense, his response was, no, only that I will say that I'm thankful that he vouched for me. Though my probation officer said he's never stuck his neck out for somebody to get housing. And I wonder, had I not been a suspended lawyer, had I not been white, I wonder if he would have stuck his neck out for me. And this gets me to the Housing First model approach and why that this is important. The Housing First model was first created with people who suffer from a substance use disorder or mental health issue in mind. They make up about 10 to 20% of the homeless population. But what most people don't realize is in order for them to obtain housing previous to this model being created was that they had to be abstinent from all substances. And sometimes places would require a person to be sober up to 90 days before they were even eligible to move into their program. This is a harm reduction approach which supports public health policy. Abstinence from substances is not required for retaining housing. The 6 main principles of the Housing First model are direct placement, services that are implemented for the consumers. It is not mandatory for them to participate in exchange for a place to live. Relapse from their mental illness or substance use disorder is not grounds for eviction. Outreach is utilized with the purpose of serving reluctant consumers, and case management for clients is still available, even if the consumer has left for a short period of time. And I do want to stress that stable housing does reduce recidivism. So the Housing First model has had an impact positively in reducing recidivism, because when people are housed, they are a lot less likely to commit any crimes. And this brings me to the second part of our presentation, which Carl Eric will be presenting. So Carl.
All right. Hello, everybody. I'm going to go ahead and switch over the share screen. Okay. All right. So. Okay, everybody can see this, correct? Okay. So I want to thank Chris and Macy real quick. I think their presentations were awesome, and I feel like everybody's presentations here are going to be very complementary to each other. So as we go into this, this part 2 here, I'd like to talk about our collective action approach. I've been working in the collective action approach for about 3.5 years now. I previously worked with the United Way, and I currently work at the Salvation Army, and I continue to do this work in a volunteer capacity as well as part of my job. And I also am on a team with Purdue to write a guide on implementing the strategy as far as substance use and mental health goes. So our collective community action approach combines appreciative inquiry and the complex adaptive systems within the complex adaptive systems framework. The model is really about resolving challenges at the community level through a grassroots approach. We originally used this for, actually we're still using it for, we've been doing it for several years on substance use and mental health issues and enhancing our system and our community services in that sector. And we have applied it across the board in as many places as we can. We are now adapting the model to be used for diversity, equity, inclusion. However, we're only about a month into that, and we're I think I'm very optimistic, as I believe the whole group is. So we'll see how that plays out for that particular project. But overall, this strategy should be adaptable for resolving all kinds of challenges at the community level. And in this case, we'll be talking about using it in resolving the felony barriers for housing through the grassroots approach. So what is appreciative inquiry? I'm not going to spend a whole lot of time going over this, as I'm assuming that many folks in here are familiar with it, but I did want to mention the one major component that that I believe appreciative inquiry and complex adaptive systems or systems thinking really shares a lot of traits and complements each other as well. In this case, I'd like to show that it's about seeing, appreciative inquiry is about seeing the wholeness of the human system and inquiring into that system's strengths, possibilities, and successes. So again, you know, it's looking at aspirations and connecting with people. So what does that mean? Well, under the principles, I'm not going to get too into each of these principles, but I wanted to kind of highlight some aspects of these and how they tie into the complex adaptive systems and the overall approach. I believe all these principles really speak toward the human experience. It's about understanding and creating a reality that we all share and participate in. And then the other piece of these principles is really speaking toward perspectives and aspirations. So really, comprehensively, when you look at all these principles, what they're getting at is you need to understand what's going on, you need to understand what people are going through, how your system is operating, and then through that you can create a vision and turn that vision into action. So we do this through the 5D cycle, as I'm sure many of you are familiar with this. I'm just going to lay out the diagram here so you can kind of see, you define what you're going to focus on and you put it through the process. I'll be walking us through the process a little bit later in a hybrid version with complex adaptive systems, but I did want to make a specific mention about the debrief component. Now, debrief isn't always in these diagrams, but this is a valuable piece, especially at a community action context, because it's about maintaining that momentum. So when you reach the end of your first round of the cycle, you want to be able to show the successes and really connect with the folks who are putting the work in and continuing to motivate them and keeping that momentum going as you continue to go around the cycle many times. Because through a complex adaptive system, really it's about taking cycles through cycles and enhancing the system progressively. So don't just go through it once, you got to go through it many times, or as many times as you can in order to make the best impact possible. So now that we're transitioning over to the complex adaptive systems component of this, the context in which we're doing the appreciative inquiry is based on the systems thinking approach. So really what this is getting at is that systems thinking is really looking at how things operate, or the relationship between things. And in event-oriented thinking, you know, you've got your root causes, which are really almost like a point in time or a specific original cause, which is not really that ideal when you're working with community transformation. What works best for community transformation is the systems thinking approach, which is more about dynamic forces throughout the process. As you can see in the diagram to the right, root causes are not individual nodes. They are forces emerging from particular feedback loops. They're more about processes, not about specific events. So what's important to understand your processes are the interrelationships or the context of connections between the points, between organizations and individuals and services, and then the perspectives. So how is each person experiencing the system? Because that's going to be really important for us doing your community assessments, doing your asset maps, and understanding what's going on. And again, boundaries is really important because defining how you're going to impact your system, you've got to figure out what your boundaries are. And oftentimes it's good to start smaller if you don't have a lot of resources and assets available, and then increase your scope as you build your work group. And we'll get more into that in a little bit here. So just another further breakdown for complex adaptive systems. It's the engineering approach to systems thinking. It's about changes and inputs of system components, which are generally nonlinear, again, as more like feedback loops. And this really leads to evolution and adaptation of the system. What that means is sometimes they can be unpredictable. They can be a little chaotic, which is actually kind of fun, but it also makes it hard to stick with a concrete strategic plan from start to finish. You gotta allow yourself to be flexible in that. So in some sense too, it's better not to have one leading organization or individual who's orchestrating the process or the strategy. Sometimes it's best to have a community input, which I think was mentioned in some of the other presentations. You basically go out there and you get input from everybody to say, what do we need to do? And what do we have available to us to do? And so the controlling agent is really a consensus-driven approach. And that really works better with a complex adaptive systems, because those are hard to control. So it's better to have everybody kind of contributing and understanding. And then furthermore, we'd like to kind of highlight how this is in a community, and the community functions as the complex system, whereas the organizations and services are the actual system components, which a human being or an individual is traveling between those components through processes, and it kind of creates a flow chart. You can actually develop a flow chart from that, which we highly recommend. So using the effective CAS approach requires an inclusive process. So in this context, we're talking about folks with nonviolent felonies and drug offenses trying to find housing. So you need to include those people in your discussion about what's going on in the system and how it can be improved. So you want to include everybody who's a shareholder, everybody who's impacted, and really that particular population of focus really can have some major insights on how the system is operating. Second is to understand the system and patterns. If you're not able to do that, you really need to work on doing assessment and doing a map to actually map out processes in the system, because that's really going to be your measurements on how the system is operating and how it's changing over time as you implement projects to enhance your system. Next is about focusing on what can be done through knowledge and assets of individuals. So sometimes this is where communities get stuck. And this is what we recommend is really important to basically look at who's willing to commit some work, willing to commit resources and time. They come to the table and you try to figure out from them, what are the assets you have available to you? What can we do in the moment? You may want to do something, but perhaps it's out of reach. So don't get stuck on that. Figuring out what assets you have now and being able to utilize those to make immediate progress on improving the system through gradual steps. And again, that goes to resolving challenges through incremental improvements that respond to changes in the system. So as you make small improvements, reassess your system and figure out if your longer term view of what you're trying to accomplish still is compatible with how the system is evolving, or if you need to adjust current projects to speak toward any transformations in the system that may have already occurred. Next is to remain flexible and adaptable. Again, that's looking at how the system is transforming and what you're doing, and figuring out to make sure that those continue to align throughout the process. And finally, again, speaking to those principles of AI or appreciative inquiry, we believe all these aspects directly relate to those principles, and they tie in really well with the complex adaptive systems approach. So this is a diagram of our combined strategy. I've broken it down into 3 stages and then a 4th component. So really stage 1 is about defining and discovering. So what is the issue? And then figuring out what's going on in the system. How is it operating? The next is dream and design. And that's where your aspirational views and you understand how your assets can be used, and you kind of come up with some ideas of what can we do? What kind of projects can we do in the community to resolve the problem that we're seeing? And
Carl, you're at 18 minutes. I know that we have extra time, but just so you know, we need to wrap up for questions and comments.
Okay, I'm getting there. So the last part is deliver and design and deliver a destiny. So that's about actually figuring out what you can do and implementing it. But the fourth component I really want to speak toward is documenting the system evolution, which I've said several times now, which is important to understand what's going on and how it's transforming based on your work. And 9 is repeating the process. So you want to continue over and over. So finally, I also recommend a continual effort to expand your work group and partnerships to increase available assets and opportunities, because that will enhance and maximize the number of things you can actually do to resolve the problem. So critical considerations for assembling a work group: facilitators should be a neutral party. Again, that ties in directly to the complex adaptive systems model, where it prevents some things from trying to be controlled when they're actually very difficult to control, or people to be too rigid for adapting to change. Include people from the focus population, invite people or organizations with decision-making capacity, which is pretty self-explanatory. Reach out to stakeholders and allies across the community to maximize, and really the goal in doing so is maximizing and diversifying your assets capacity of the work group. So this is pretty much the end of this, the summary of the process. So identify your focus. In this case, it's reducing housing instability and recidivism. 2 is map out the current system through community assessments and creating a system map. A system map is very important. It creates a visual diagram of how things are operating and how people flow through the community. 3rd is assembling your work group. Again, include the population being served. 4th is develop your aspirational questions. So what would it look like if, and that will help you create a shared vision of the future. 5 is identify what can be done. Again, figure out what assets belong to the folks who are actually willing to commit work, and put those assets together to create some projects, and then choose what will be done. So choose a project that's going to have the highest impact and be some of the more easily implemented. And then 7, deliver. So everyone should be taking action to move that project toward completion, and create time periods to report back, or basically an ideal time to complete that project. 8, document the evolution, and 9, repeat the process. So here are the research that we both used for our community action component, as well as Alicia's study. And then here's our contact information and a few resources that we believe can help communities implement this process. 1 is the Recovery-Oriented Systems of Care Document Development Protocol Toolkit, which is now under development through a partnership between Purdue University, Ohio State University, and University of Illinois, and that should be being produced and put out hopefully sometime later in this year. And then the next one is that the Center for Disease Control put together a Promoting Health Equity resource to help communities address social determinants of health document, which has been absolutely fantastic, and I highly recommend that. That's pretty much everything. Any questions?
Thank you. Questions, comments?
The slide with the steps was super helpful, so thank you for including that. Sorry I had to power through it, but it was helpful.
I'm either really great with timing or really bad with timing. We do have extra time at the end. So we have, also, if you put your emails in the chat, it might be helpful as well. Other questions, comments for the presentation?
In our office, we also work with mental health first aid. So I think that recidivism is like, or just substance abuse and misuse, and like the PRISM system is very stigmatized. So what in y'all's practice are good steps for kind of entering that? Because we've actually recently with rideshare options started looking into partnering with more of the prison system and going into communities like that.
So what aspects are you looking for advice on engaging with? You talking about actually with the prison system?
Mm-hmm.
Okay.
Yeah.
Now, prison systems traditionally have a major barrier of staffing, actually, because there's a lot of screening that goes on to getting in there and engaging with that population. And that was a big problem here, as well as many others, that they just don't have enough people to go through the screening, to help with the screening process to get organizations in. So it's good to figure out who's already getting in there, who's already got time to go see those folks, partner with those organizations because they've already gone through that entire process, and simplifies it for everyone. And figure out how to put together a package of materials in order to engage with that population. Or if the prison is able to do it, maybe use telecommunication services. But ultimately, we found that creating lasting partnerships, I mean, we've been developing our coalition here in Tippecanoe County for several years around substance use and mental health. And really, it was those partnerships, and it probably took a year and a half before we were really getting more into the jail system here. But it also involved, the sheriff's election was a big component in that. So politics can get wrapped up in it all. But it's kind of like figuring out who's willing to put in the time and effort to help resolve the problem, and then look at what their assets are, and then leverage those assets to do that work. If the sheriff or the jail commander or that staff is not available to you, or they don't have the time or commit the time to do that, then look around for another doorway or another organization that may already have that access and use them instead. That's my best advice for you, I think.
Thank you. That's really helpful.
There has been, I just wanted to say too, real quick, is that I'm not sure where you are, but I know in Indiana, they just passed a bill that permits, it was requested by the DOC, and the director of the Department of Corrections is trying to implement and be part of that recovery-oriented system of care where there's warm handoffs and so on and so forth. So they passed a bill, it's a small bill, but and it'll affect, she said, probably 2 to 3 inmates a month, but it allows them to hold an inmate up to 14 days longer if necessary while they look for beds, because sometimes beds will be available by the out date, but if somebody else fills it in emergency and stuff like that, it's not to be a punitive action. The inmate has to agree to stay, but as it stands, prior to this, the DOC couldn't just hold somebody past their out date. So there are things happening. You just have to look into it and see wherever you're located, what the prisons are doing, because they do want to be, they are part of OROSC. So.
I didn't know that. Thank you.
Other questions, comments? All right. Well, I want to thank all of the presenters. The research was very interesting, and I love seeing the overlap and engagement between the 3 projects. So thank you for your presentations. And if anybody would like to comment, contact any of the presenters, their emails are in the chat. And thank you again.